Living in an arid, dusty environment prone to sandstorms can create a whirlwind of respiratory problems for some UAE residents who suffer from asthma. According to the Global Asthma Network, an estimated 1.3 million UAE residents, or around 14% of the population, suffer from asthma. Weather experts say that in general, the spring and summer months are peak times for sufferers, with higher levels of fine sand particles in the region's atmosphere.
Either in the Arab Peninsula and North Africa, there are wide expanses of scattered sand dunes. This, along with high winds, might stir up the dust and sand, transporting it to densely populated cities. Therefore, this has an impact on general health for people, mainly that have issues with their respiratory tracts.
Like Khawla from Jordan, who has struggled with the condition for around 20 years. The 57-year-old who moved to the UAE in 1979 takes medicine every other month, which costs more than $3,500. Khawla says her severe symptoms left her prisoner in her own home.
The humidity would affect me a lot, and the sand, to the point where I would faint for hours, from all the exertion, from walking, my breath, from the dust and humidity.
Also affecting chronic respiratory diseases is air pollution, which contributes to the premature death of around 7 million people worldwide every year, according to the United Nations. Taking the matter seriously, the UAE intends to raise air quality from its current level to 90% by next year, as part of its National Vision 2021 agenda. And last year, the capital announced the creation of a new chronic disease registry to improve healthcare outcomes and treatments of conditions like asthma. Another move forward saw the UAE's only dedicated asthma and allergy center open in Abu Dhabi last year. Allergy specialist Dr. Carr says that due to low awareness, sufferers are often misdiagnosing their symptoms or not seeking out preventative care. Overall rates in the UAE are more than 5 times higher than in North America.
Studies in the region show that as many as half of patients with asthma in the UAE have an emergency care visit at some point during the year or miss school or work because of their asthma, and 4% of patients with asthma in the UAE end up hospitalized annually, and that's a very high number.
Asthma medication might be a combination of drugs, including corticosteroids, which can be inhaled to reduce inflammation and quickly relax the muscle airways. Dr. Carr believes that with a healthy lifestyle, an early diagnosis, and regular lung function tests, sufferers could minimize their amount of treatment. And while there's currently no cure for asthma, his advice could come as a breath of fresh air for regional sufferers.